Ramirez works closely with referring physicians and assists patients in achieving their rehab goals while educating them on injury prevention. Sylvestra?
Good afternoon, everybody. So I'm going to answer the questions in a little unconventional way. I'll be telling a couple stories. So I'm going to start off by asking everybody a question. Why are we all here today? Seems like a silly question to ask the last session of the last day of a conference, right? Well, in a moment you'll realize why this is a critical question we should be asking ourselves every day. As a new graduate of a phenomenal physical therapy program at Rosalind Franklin University of Medicine and Science, I was enthusiastic, excited, ready to get out to begin treating patients. My faculty, many of who are here today, had equipped me with a toolbox full of knowledge. I was ready to start teaching my patients exercises. I was ready to monitor their cardiovascular responses. I was ready to assess their improvements. I had the excitement to be that crusader of change for my patients. And furthermore, I was excited to do this with my fellow healthcare providers. So I began working as a physical therapist at a large hospital setting in Milwaukee. And I did this because I wanted to surround myself with fellow healthcare providers and the entire healthcare team. But little did I know that interprofessional collaboration was not number one on everybody's to-do list. After I saw a patient and assessed them, I wanted to communicate with the nurse, share my findings with the doctor. A lot of times I wanted to search for the social worker who was down the hall when I had concerns about a patient's living situation. But sadly, nobody had time for me. So this large amount of enthusiasm and excitement that I felt upon graduation to advocate for my patients slowly started to diminish. I felt like nobody wanted to work together. Everybody was just too busy going about doing their own thing. I felt like my efforts were really not making a difference. Until one day, one of my patients spotted me in the grocery store and hunted me down and told me how I had made a difference in his care. He told me he was back to his 4-day-a-week walking routine, and he was even able to cut down on some of his diabetic medication because he was following healthier ways of eating. So thinking back on my first few years of physical therapy as a physical therapist, I wish I had had a little more faith in the remarkable benefits and possibilities that interprofessional care can have on a patient. At times I wanted to reap the benefits right away. I wanted to force that communication onto healthcare providers because I wanted to help solve patients' problems then and there. But it took time for other healthcare professionals to really come around. And at times when I got discouraged, I would always ask myself, why am I here today? And the answer was always, I was here for my patients. The 3 pearls of wisdom that I want to share with the students in the audience is that interprofessional education is great. It really is the foundation of our healthcare practice. Second, that interprofessional collaboration takes time. So we can't expect results today, but we should know that we're on the path to making remarkable improvements. Third is to continue to be passionate and excited about embracing interprofessional collaboration, because in the end, this is what's going to change a patient's life. We all have this high level of excitement after listening to some remarkable speakers these past 3 days. Probably a little fatigued, right? But let's just talk about the excitement for now. We've all filled our toolboxes and we're ready to go back to our communities and make some changes. So let me ask everyone that initial question. Why are you here today? Many of you are here because you are the crusaders for change. For your patients, your enthusiasm and passion for interprofessional collaboration is going to change healthcare. Thank you.